Hi, my name is Sherry Willis. I'm the Public Information Officer with the Alameda County Public Health Department. I'm here today with Dr. Bob Benjamin, one of our communicable disease physicians, and we're here to give you a primer on H1N1, commonly known as swine flu. So, Dr. Benjamin, why don't you start off by telling us what is H1N1?
H1N1 influenza is an influenza much like any other that we've seen before. This one is unique in that this particular strain has not been seen in 50 or more years. The reason that's important is almost the entire population is therefore susceptible.
And when did we first discover H1N1?
Well, it was back in April when an outbreak of a fairly severe influenza was first identified in Mexico.
So what are the symptoms? What should we look for?
Well, the symptoms of H1N1 or swine flu are much like that of seasonal influenza. The predominant symptoms are fever, severe muscle aches and pains, sore throat, runny nose. Occasionally there may be nausea, vomiting, and/or diarrhea.
So what should I do if I get sick?
Take good care of yourself and not infect others. Stay home from work. Don't go to school. Drink plenty of liquids. If you're getting really severely ill, you might want to place a call to your usual source of medical care.
So germs count?
Germs count a lot. This is a disease that's spread person to person, generally through coughing, occasionally through direct contact. We're really asking people to practice good respiratory hygiene, good etiquette. Don't cough into your hand like that, because then you reach for a doorknob or you go say, "Hi, good to meet you," and shake hands, and you can transfer virus that way. We're asking people to cough into the kids. The kids have a great term for it. They say it's the Dracula cough. Cough into the crook of your arm. That way you don't contaminate other surfaces or other people's hands. Wash your hands frequently. Don't put your fingers in your eyes, your nose, or your mouth, especially after having contacted other surfaces.
I understand that most of the cases are mild, but for those people who actually get very sick, for adults and children, let's start with children. What are some of the warning signs that the disease may be really serious?
The symptoms for little kids are pretty much the same as for adults. The things that you have to worry about most for little kids: real difficulty in breathing. Skin or mouth or mucous membranes turn kind of bluish color. It means they're not getting enough oxygen. Kids, especially little kids, and we're most worried about kids from the infants on up to 2 years, even to 5 years, having problems with thinking, not waking up clearly, severe cough, severe vomiting, irritability. Call your doc, consider going to an emergency room if the symptoms are that severe.
And for adults, the warning signs that the disease has gotten really serious are about the same?
These warning signs are about the same. They include difficulty breathing, pain or pressure in the chest, possibly the abdomen, dizziness, confusion, severe vomiting, and for both the pediatric and adults, symptoms of flu that seem to go away and then return again but appear to be worse.
Okay, we hear that a lot, that people can't shake it off. So what should people do to prevent spreading the infection?
Basic personal hygiene. If you're sick, don't go to work. Don't go to school. Avoid public gatherings. I know that the party that you were invited to on Saturday night is going to be a good one, but don't go if you're sick. Wash your hands frequently. Cover your cough, as I said. Use the crook of your arm to do that.
There are lots of prevention steps which you mentioned, and one of them could be to get a flu shot, right?
Oh, absolutely. This season, we're going to have basically 2 circulating strains of influenza. The seasonal one, for which there is immunization. It's probably due out late September, early October. And then the second series of immunizations will be for this H1N1 swine flu.
And this sounds kind of, this is different from what we've seen before. Should people panic?
No, I don't think so. What we've got right now is seasonal influenza, which is what people have experienced for decades. We have this new influenza strain, which appears in most folks to be quite mild, but because we're expecting so many people to be at risk of being infected, we really want them to be immunized to keep the total numbers of sick people as low as possible.
Okay, thank you very much.
You're welcome.